Hi, my name is James Andriella, and you are listening to the seventh episode of the Back to Human podcast. On today's episode, I have special guest Dr. Artour Rakhimov. He is the world's leading inventor of breathing retraining methods and the developer of the Buteyko method, as well as author of Normal Breathing: The Key to Vital Health. And today we will be discussing how you may not be breathing properly and just a little bit more of like the physiology behind breathing. We'll be talking about carbon dioxide, oxygen, and yeah, without further ado, welcome to the show, Dr. Artour Rakhimov.
Yeah, thank you, James. Thank you for inviting me. Yeah.
Awesome. So, how did you come across breathing less? I guess that'd be the easiest way to put it because I know there's a lot of different breathing practices and people often refer to it as deep breathing. But how did you come across the fact that a lot of people are chronically hyperventilating and how this may be leading to some of the health issues that they're experiencing?
Well, personally, myself, my journey started in year 2000, and I just discovered a book that was written by one Russian practitioner. He was actually very famous about like 20 years ago and before that, because he brought the method from the Soviet Union. He was trained and spent a lot of time with Dr. Buteyko, and he moved to Australia. Then he was in the UK and also traveled to some other countries like Ireland, the United States, where he trained a lot of people, and many of those people also were trained as practitioners. So that was his book, written actually in English, even though he was like kind of originally from Russia. And again, you can recognize that I'm also like a quite heavy Russian accent, even though I live in Canada for 28 years now. So I just found this book and like started to check, was like completely kind of counterintuitive ideas about that. To be healthy, we need to breathe slow and less air, and to have more carbon dioxide. That was central ideas in this book, as well as this simple DIY, we call it control pause or breath holding time, special breath holding time test that our students do to monitor and measure their progress. So, and what kind of fascinated me myself, I had also like several various quite serious like health problems at the time, like a lot of infections, very high fluctuations in blood sugar in the morning. So, and I applied this technique. Blocked nose could be another one, very long sleep, a lot of fatigue, like a variety of symptoms. And in a few days, like I solved, I don't know, maybe 80-90% of them. That was really impressive for me, like in a few days, really. And my pause, control pause increased from about 10 to 30 seconds, also in a matter of like just several days. It took me time. It was way slower. It took me longer time to progress further up. Like it's a long story to explain. But what I was interested about, like, okay, if this technique, what would be other ideas and related maybe information to that? Because what Dr. Buteyko discovered, it's not just like, as you mentioned, doing some breathing exercises. He was particularly specific about the idea that the method he developed, it's not about doing exercises, even though they can be absolutely necessary for progress, like necessary component for students to progress. But what he was talking about all the time and kind of emphasizing to his practitioners and students, that it's more important how we breathe the remaining 23 hours or whatever, 22 hours of the day, particularly during sleep, for example, or when we are not aware about our breath. So, and here we go into the area of so-called automatic or unconscious, or Dr. Buteyko sometimes called basal breathing. So the breathing that exists day and night without our awareness about it. And so here, his ideas was actually also in a way very simple, because what he suggested that people need to breathe in accordance with medical norms, like nothing kind of funny or nothing kind of special, like some special like diet, food, exercises, and so on. So just go back to medical norms, and that will allow you to have a good health or normal health. So when Dr. Buteyko started to test these ideas, like he developed them already, I think like second half of 50s probably, where these main ideas became quite clear to him. But in 60s, he was the manager of the respiratory laboratory in Novosibirsk. This is a very large scientific center. We have like so-called Akadem Gorodok, and this is like city of, basically like city of academicians, we can translate it. And it's very famous in Russia among like scientists of what we would know this place, because there are many research institutes located there. And so that was one of the research institutes where he worked for. And he discovered that actually all these chronic diseases, again, like including, of course, main killers, and that's like what 70% of people die from. That would be, let's say, heart disease and conditions related to heart disease, hypertension, and so on. Then diabetes and related conditions, cancer and asthma, bronchitis, COPD, those conditions. So these would be like among 4 main killers, that all these conditions respond really well in terms of people get fewer symptoms, and eventually we achieve a medical norm for respiration. They would not require any medication, and they would not have symptoms, even though this path can be really long. Really long, I mean, like, well, sometimes could be few people who may get it in 1.5 to 3 months, probably would be among shortest time, but commonly it would take many months. And I knew people for whom it may take some years before we normalize the breathing pattern. So therefore, Dr. Buteyko kind of, I already explained it in the past on my YouTube channel, made two quite different discoveries, I would say, and that maybe can cause confusion even among practitioners or like kind of advanced students, because one discovery related to the fact that people are able to overcome their health problems by retraining the breathing pattern. So we breathe in a certain way, and he discovered, and this is true, I know, according to dozens of studies, that people breathe too much. They have chronic hyperventilation. I have like normalbreathing.com has a table with about 40 studies where Western doctors measured exact numbers, how much people breathe in terms of minute ventilation. And so this is what this first discovery was about the ability of breathing retraining to fix these health problems. So that's one part. But another part relates to like kind of a different thing, which is the Buteyko method itself. And this is a set of activities. So you do, let's say you do like this breathing exercise, and you do physical exercise in this special way, then you sleep in a special way, with diets and so on, like many factors that would do. Depends on the practitioner, on the student, like how much they're going to apply. Like this, in total, could be, of course, I would say probably tens of different factors and variables which influence our respiration, our automatic unconscious breathing. So there are two parts which kind of, in my view, reflects two main discoveries made by Dr. Buteyko. So like one, again, Buteyko method as a set of activities, and another is kind of more general discoveries related to abilities of breathing retraining to deal with, again, like chronic lifestyle diseases or diseases of civilization, from which, again, so many people suffer from.
So you saw results pretty quickly yourself.
Mm-hmm.
And you were mentioning asthma. So with asthmatics, they feel like they can't get enough oxygen. So whenever you come across an asthmatic that you're working with, is there like an element of fear that comes to them because you're telling them to breathe less? And what people don't really understand is that the more that you're breathing in, like the more breaths that you're taking per minute, the higher your respiration rate is, you're actually not oxygenating your tissue, because the carbon dioxide would be the actual important, I guess, nutrient. I'll call it a nutrient, the molecule that you need, not so much the oxygen. So is there an element of fear when you're trying to teach people this retraining their breathing?
Yes, absolutely. Yeah, there is certainly the element of fear, like kind of maybe psychology related. That's why there are kind of, I would say it is addressed on different levels, on many levels. So one of them is that I already mentioned that, and I always kind of use this when I do presentations, lectures, and like talks to the public. I always mention these studies and show these tables, graphs, like showing the numbers that, let's say, if we talk about minute ventilation, so minute ventilation would be the parameter. Frequency would also correlate with that as well, like how many breaths we take a minute would be, of course, higher in people who have chronic disease. But usually, like kind of from physiological viewpoint, it would be more correct because also kind of doctors would also be more kind of more attentive to this value called minute ventilation. And in terms of numbers, normal numbers would be, let's say, medical norm is about 6 liters a minute. Some, all the textbooks may say 4, 5, 5, 6, 4, 6, 4, 7, because I've seen many, all the medical textbooks. New medical textbooks, physiological textbooks might give a little high number, 6, 8, 6, 9, kind of 7, 9 liters per minute, but we would be all still in single digits. And if we look at numbers for asthmatics, would be 12, 13, 14, 15, 16, depending on the study and so on. So numbers would be about twice, 2.5 maybe times larger than the medical norm. Not only asthma, of course, again, like all these other diseases would be very similar picture. So, but in relation, going back to fear, so I mentioned this factor where I would provide this information. Okay, it's numbers, you see, like asthmatics breathe too much. Now let us think about that from medical or physiological viewpoint. What is going on in the body when a person breathes too much air? So when we, then the next step would be logical to discuss, okay, are we going to have more oxygen in tissues or cells of the body, cells of the brain, heart, and other like organs, let's say, vital organs of the body, in the case when we breathe more air? So would it be right or wrong? And also here we can again kind of approach it on two different levels. One level would be, I can mention hundreds of studies, and I have many of them in my books on the website as well, where doctors simply measure how much the amount of oxygen using special devices, how much is oxygenation of the brain, heart, kidneys, liver, spleen, colon. All these studies are done most commonly on animals, of course, on horses, dogs, other animals, and most studies probably would be also quite old, like 40s, 50s, 60s. They're kind of more fundamental physiological studies done long time ago, but there's still like some replications done more recently as well, maybe with less intrusive techniques as well. So therefore, we can address it on this level. Then we can also, okay, do another, that would be probably third way, how Soviet doctors and Russian doctors and how Dr. Buteyko trained practitioners himself, because in the past, and Dr. Buteyko was using quite intensively so-called hyperventilation provocation test. And I have it described again in my books for practitioners and on the website. And it was quite common among physicians or like medical doctors, GPs, so-called general practitioners, decades ago, probably now not so much. So what we did in the past, this test was used in order to identify the most vulnerable system of the body. This is what we believe, because there are truly many studies done for various groups of patients where it was shown that this test is highly specific in terms of, okay, if we take people, let's say a group of people with certain conditions, and ask them to hyperventilate, what is going to happen with this group of people in terms of, okay, what we are going to feel in terms when we hyperventilate, when we breathe more air? And it was discovered that this test, up to, in many cases, 100%, few studies maybe 95, 98% specific in terms of what is the main symptom, what is the main like health condition the person is complaining about. Let's say, again, take a large group of people with panic attacks. That would be, again 98%, 100% of them, according to various research studies, are going to experience panic attacks because of voluntary hyperventilation. Asthmatics would be, again, 95, 100%. People with epilepsy would get seizures. So, like, okay, this is highly specific for them. People with stroke, well, stroke would be a bit dangerous condition to try because you can understand, so because of that. But people, let's say, with hypertension would get angina pain, so people with heart disease, and that would be, again, like very different symptoms they experience. Asthmatics in return would have chest tightness, feeling that they don't have enough air, shortness of breath, so-called, and maybe we'll have some wheezing as well, like if, especially if doctors put stethoscope to listen. And that would be, again, highly specific in relation to that. So the next step, this is what Dr. Buteyko would do in 1960s, for example, as well as 70s, 80s later. He would ask his patients to breathe less, to breathe a little slower and less. Let us calm down your breath, like not take as much air as you want, little bit less air, and then relax to exhale. Take a little bit less air than you want, than your body wants to take, and relax to exhale. So you are going to accumulate or experience some shortage of air, some air hunger, but to very light degree so that you can relax, because it works only when people are able to relax. If you try to suffocate yourself too much, which we may do, let's say if you create very strong air hunger by, you would create a very strong air hunger if you breathe, let's say, twice less air that you have right now. That would create a very strong level of air hunger. But that would not allow for most people to relax, especially if they are kind of new students, if they're just kind of learning that. With time, it's possible because you can train your body how to relax even with stronger level of air hunger. So, but yeah, that would be the third level, how to overcome this fear you mentioned in relation to people, let's say, with asthma, how you can ask them. And at the beginning, I found it's extremely common, like when students do the very first lesson of Buteyko exercises, and we breathe a little bit less air, it's very like strange, and I never had this sensation in my life before, because nobody asked them before. They would do like through the nose, through the mouth, hyperventilation, sometimes maybe before diving, sometimes maybe for whatever other reasons, but breathing a little bit less air, that's again a very uncommon experience. And that's why, again, the sensation is a bit strange, unusual, but after 2-3 attempts, like people just like totally comfortable with that, and we just get, of course, very friendly with that as well. So most people start liking it because for many people it may just allow them to reduce medication 2 times, or maybe completely get rid of bronchodilators, for example, in case of asthmatics.
So you can reproduce whatever symptoms people are feeling by getting them to hyperventilate.
Yes, yeah, that's why it was called hyperventilation provocation test, and that's the medical name that was used by probably by hundreds of doctors on the West. So hyperventilation provocation test, that's how it became known historically. But again, for whatever reasons, I don't know, maybe it's technology, maybe just too simple, for modern doctors not to ask patients hyperventilate. So they use like fancy devices and complicated tests instead of this simple method. So yeah, that's.
And do you find that whenever you're working with a new patient, that they're actually able to make the connection that, okay, maybe why I'm experiencing this is because I'm breathing a little bit too much? Because I know there's another popular breathing technique. It's called Wim Hof. I'm sure you're familiar with it. And the beginning of that is 30 to 50 quick breaths. So
yeah,
I'm not too familiar with whoever they're working with, but I could imagine that a lot of their symptoms would come up then too, no?
Well, there are like 2 questions you asked here. Yeah, the first one. So second one, yeah, I can explain Wim Hof a little bit later. Now, so what this hyperventilation test? Yeah, it is highly specific, as I mentioned. So, and that would again, like since it was used by doctors, yeah, we just people would normally what would happen again. When Dr. Buteyko would do this test, and he described it many times, because I myself, I don't do this test with my students, but students still understand the idea of breathing less, and we like the idea because we notice very fast. Particularly asthmatics are going to notice very fast because the method teaches them to use this technique of reduced breathing instead of using the medication. Now, another great part, kind of maybe complementary part to this fact, is that modern doctors, probably all over the world these days, they would teach asthmatics to use the medication on demand. I'm not talking about like steroids when we use cortisol, like some heavy medication, would be severely sick people, but for majority, like 90% or more of asthmatics, when we use all these bronchodilators, Ventolin and so on, So we are used on demand in terms of when we experience symptoms. Okay. So what Dr. Buteyko suggested, okay, let us use this simple breathing technique instead of medication. And here what happens that overwhelming majority of asthmatics would not require medication, probably not at all. Probably majority would not at all if they have mild or light asthma. So, and that's why the technique became so kind of popular among asthmatics, and why on the West and around the world the Buteyko method is commonly known. Like if you ask many people, what is the Buteyko? Oh, that's the treatment for asthma. So that's maybe because many clinical trials, 6 randomized controlled like clinical trials on asthma done on the West already years ago. And there are some US studies done as well more recently, which were not maybe like as rigorous like according to medical standard, but we still have all these positive results related to solving asthma. The problem with trials, as I see, like I also describe it, it's really very difficult, first of all, for people to achieve the norm, even medical norm, because another kind of related fact here is there are actually 2 norms for people who teach the Buteyko method. Why? Because there is a medical norm, which is again like medical textbooks provide, like let's say 6 liters a minute, 10-12 breaths a minute at rest. You have to have about ½ liter for 1 breath, which is tidal volume. So if you multiply 6 liters, so 6 liters, how we get 6 liters? ½ liter, 12 breaths a minute. So that would be 6 liters in 1 minute, very small amount, minute of course, of air at rest. And 40 millimeters mercury or 5.3% at sea level of carbon dioxide in the arterial blood. So there are also a variety of other kind of related venous blood, oxygen levels, and so on. So control pause normal number would be about 40 seconds. And medical studies from about 120 years ago indeed show that just ordinary people used to have at the beginning of the previous century about 40 seconds for breath holding time test on exhale without any stress. Whereas Dr. Buteyko normal would be way more rigorous. It's 60 seconds for the CPO control pause test, 4 liters, about 4 liters for ventilation, and maybe about 8 breaths a minute. So it's a bit even slower breath day and night. So there are kind of certain changes here. So that's about his norm, and to achieve that norm is actually very hard because not so many practitioners have this norm and achieve it or experience it, like let's say, for some days.
And it's difficult for people to achieve that norm because of many different factors based on what I've read in the book. So as you said earlier, there's a lot of activities, and maybe it's not so much just about like the exercise alone, it's the activities that are contributing to the overbreathing pattern that people are experiencing. So let me see 1 second. Oops.
Yeah, that's absolutely right. In order to achieve the norm, students need to address many factors. We are talking about tens of factors in general. And big problem here is probably would be some requirements which lead students to success could be relatively restrictive in terms of time. For example, most time-consuming activities which would lead to success in students would be physical exercise and breathing exercise. And probably physical exercise may take even a bit longer time for advanced students. We should spend a bit more time. So Buteyko method in a way was a technique which kind of based on and in terms of achieving and maintaining very good health on physical exercise. And Dr. Buteyko was also very clear about this fact or this discovery that he made already again in 1960s, that in terms of we can ask like kind of 2 different questions. So I hear these questions all the time from students. In terms of, again, we are now very sick, so we have 70% mortality from lifestyle diseases, and this mortality was 10 times or probably even more less, let's say, at the beginning of the previous century, 1900, 1910, 1920. And people ask 2 types of questions. So why we are so sick now and why people in the past were so healthy. So two kind of things. Answering this part, why people in the past were so healthy. Dr. Buteyko had a very strong belief, and his doctors as well, whom he trained, that people just had way more physical exercise because it was totally different time. No cars, no computers, no cell phones. So jobs were very different, of course, like more than 90% of people would have job which involved labor, physical labor, moving your body up to 6, 8, maybe 10 hours or more every day. So a lot of physical exercise, often quite heavy physical exercise, and that would allow them to stay healthy. Of course, people may say we had like virtually all food was organic, water was super pure, and that is also right. That would be, of course, correct to say that all food was organic in 1900, for example, and so on. So then that would be one part of the equation, and so here we can see this kind of related factor that physical exercise actually was treated by Dr. Buteyko as a kind of necessary or maybe central part of health of people. So, and that would be, of course, in a certain way, very abnormal for a medical doctor or like family physician to tell, or that's actually physical exercise that makes people super healthy or very healthy, or a single factor that allows them to stay healthy. So that's how he would describe that, and that's kind of a factor related to this topic related to, okay, why people in the past were so healthy in comparison with people that live right now. Yeah. So that here physical exercise would be one of the factors, yeah, but it's again like factor which kind of quite complex and difficult in terms of it creates a certain lifestyle which our culture does not embrace. Our culture does not like people who doing like whatever 2 hours, 3 hours of exercise. And in terms of time, Dr. Buteyko was usually he would talk about, in my understanding, relatively easy exercise, like such as walking. But his demands would be somewhere about 4, 5, 6 hours a day. And that would allow students to have really good results for this breath holding time test, probably would achieve like any results they want. Of course, again, could be other limiting or restricting factor, but if they wanted to achieve 90 seconds or 2 minutes, 2.5 minutes for this test, and it seems to be 3 minutes maximum people can achieve for this type of test that I described on exhale and without any stress, as well as having as little, maybe as few as 3-4 breaths a minute for automatic conscious breathing, so people can slow down their breath down to this like kind of insanely low numbers, very, very little breathing, which by the way also was a bit kind of interesting and surprising for me to discover long ago when I was searching old books on yoga, that they came to the same results, to the same conclusion, that actually yoga masters, if we try maximum breath hold, would be about 7, 8, 9 minutes, but it would be on inhalation, you see, on large inhalation. Whereas if we convert these numbers to numbers on exhale, or usual exhalation, not forceful exhalation, usual exhale, when ordinary exhalation, so-called, that would be, again, would be somewhere around 2.5, 3 minutes time, would be very similar numbers. And having about 3 breaths a minute, also something which could be found in quite old, let's say 20s, 30s, 40s books on Hatha yoga and some other types of yoga, when we still practice mostly the correct or right forms of yoga, because that's maybe like another big topic. We spent another 1-2 hours just talking about yoga and how it changed during last about 60, 70 years probably.
So you'd say it's changed for the better or for the worse, or it's just different?
Or generally for worse, because first of all, 60, 70 years ago, yoga was way more about breath and way more about doing pranayama or slow and long in terms of time duration breathing exercises. So these days, yoga more about postures and asanas, and breathing takes quite small part, not only it is small part, it is usually the part where students are not encouraged because teachers do not see value in certain changes, let's say in the way how we practice pranayama or other slow, long type of breathing exercises. Because in the past we had clear understanding what is the goal and how to move towards this goal. Now we don't have it. With very, very rare exceptions, of course, talking about yoga teachers around the world.
So the medical norm for the controlled pause would be 40 seconds, you said, correct?
Yes,
then,
yeah, there could be medical both studies, but also some sport physiology textbook which mentioned this number as a.
And then Buteyko's standard was 60 seconds, and then you can get beyond that. You can go to 90 and then 3 minutes, you said?
Yes, you can absolutely, but that's very rare. Very few people actually went on the West. It would be just probably single individuals whom I know. But Dr. Buteyko had some of his doctors whom he trained to achieve this level and to achieve 2.5, 3 minutes, 90 seconds. And we described a variety of changes actually that took place at these levels, particularly like, let's say, women may have like painless childbirth. People start to, people are able to digest, let's say, well, Dr. Buteyko was saying that at very high CPs, people are able to digest nails, as he just described, which is probably true. But in my view, what would be more important from practical viewpoint, probably people are able to digest bones. The same, like, for example, cats, dogs, they can do that. Humans can normally cannot, but it seems to be that there are some changes that take place in the power of our digestive system when we achieve high level of like breathing retraining. Not only that, let's say people are able to sleep much, much less. Commonly, which I found on tens of students whom I trained with 60-second CP, people usually sleep 4, maybe rarely 4.5 or 5 hours without trying to restrict their sleep. So we just cannot sleep longer. We just don't want to sleep longer, even if we try. So at 90 seconds and high, people probably would be sleeping somewhere around 3 hours. And Dr. Buteyko himself would be sleeping about 2 hours every night. Like that's again common pattern, which I found again was kind of interesting discovery for me many years ago, that yoga books mention the same number, like yoga master. If you're a real yoga master, you should be sleeping 2 hours a day.
That's one of the main things that stuck out to me while I was reading your book, and I was fascinated by that because I would love to be able to sleep like 2 to 3 hours and still function. So what if you're like exercising rigorously? So I know that he recommends just light physical activity, but what if
Yes.
it's people that are weightlifting or people that are professional athletes?
Oh
Maybe
yeah,
they're
absolutely. No, that's yeah, that's of course very important practically in terms of like time investments topic. I believe that people are able to exercise way less time, and it seems to be that somewhere around 2 hours a day of intensive exercise, with additional probably about an hour of walking here and there, like go shopping, go like whatever, like small walks throughout the day. That probably would be enough for a person to get practically any CP result. So somewhere at this level. Now, here would be another kind of factor, which probably would be like a discovery that we made with our students during last years, that it's not necessary, and it's even better not to have this exercise in one session, because I myself would in the past, let's say 10, 15 years ago, would likely to do a 2-hour session maybe in one session during the day. So I found it's way easier, especially when you're talking about like some running exercises or other, to do it in this 2 or even 3 sessions, because recovery from muscles and probably even accumulation of injuries less. So the body somehow able to recover faster and easier if you have short exercise sessions throughout the day. So, and yes, it's possible to have it way less. And our students also use many other like fancy techniques, let's say like using training mask. Also teach students how to make DIY training mask, like use like the training mask, which is like you can buy on Amazon or trainingmask.com, or yeah, the similar version of that. And do also breathing practices, some breathing exercises while doing physical exercise as well. So we all would be assisting factors. Plus, exercise is again kind of big topic. I usually, when I teach practitioners, I describe it and discuss it by health zones where students are in, and that relates to Buteyko health table, or Buteyko table of health zones, so-called, which is usually behind me when I have videos on my YouTube channel. Yeah, but I'm now in the hotel and traveling, so I have it with me, but I thought like not so easy, like in a hotel to put it on the wall. So, but the idea there is these CP numbers, so-called control post numbers, as Dr. Buteyko discovered, we are tightly linked for many health conditions, and it would relate again asthma, hypertension, diabetes, like common conditions, cancer, and so on, which is great because then even symptoms and medication would be tightly linked to the health level. This is what Dr. Buteyko discovered. It would be very kind of practically important number, this CP test result. And that's why our students do these measurements when they wake up in the morning as a first thing, in order to just see what is the current health level is. So, and therefore, yeah, this like Buteyko table of health zones, according to Dr. Buteyko, and again, experience of our students would be also very consistent with their result. It gives a quite clear picture in terms of, okay, what is your current health state? And yeah, then my, again, explanation of physical exercise would relate to these zones, because for different zones would be different effects and how people practice. The very first step that we teach to our students to start physical exercise while breathing 100% through the nose in and out. So in through the nose out. That for more than 90% of people, of course, absolutely abnormal. Probably 98, 99% of people would be abnormal, because very few actually people naturally have this habit to breathe in and out through the nose. Statistically, it's known there are actually studies done by just like by somebody else, like people who probably even don't know the Buteyko method. That I think they found during one cross-country race with I think 3,000 or 4,000 participants that 99.7% of people were breathing through the mouth. Yeah. With 0.3% or 3 out of 1,000 runners would be breathing through the nose. Even though I was surprised, like to see Olympics and many all Africans, of course, due to their genetics, way more ahead in winning gold medals, and even like all these finals in Olympic Games, like probably would be all Africans. But what was interesting that there are many of them for different distances, including quite short distances, so like so-called middle distance, 800, 1500, 5K, up to marathon. And sometimes Olympic champions, gold medal, like a silver medal, would run all race 100% through the nose. And this is how Kenya, Ethiopia, like other countries, we would learn from childhood how to breathe, how to exercise.
I think that the nasal breathing is probably the thing that helped me out the most, I would say.
Okay, excellent.
Yeah.
Great to hear.
So, and I see it now when I just walk in public. Like I'll see people walking down the street and they have their mouth open, and I'm just like, if only you knew. If only you knew.
Yeah.
And Buteyko mentions that you should only have your mouth open when you're speaking, eating, or drinking. Mm-hmm. And as you mentioned earlier, sleep is always gonna be my biggest thing. I wish I could get to that 2 to 3 hour mark, maybe one day, because I feel like I'm so much more productive throughout the day. I'd have so much more time on my hands. But what I would find is that if I sleep on comfortable surfaces, if it's a soft surface, my mouth would have the tendency to open in the middle of the night. Mm-hmm. When I started mouth taping, that probably gave me the biggest boost out of everything. And I know it's crazy to maybe the audience that's listening, but I felt so much more rested when I only breathe through my nose at night. And I still can't get away with not mouth taping. Like some nights I'll be able to push through and know that I'm only breathing through my mouth, because I'll wake up and my breath won't smell, or it won't be super dry, and I just feel well rested. But if I fail to mouth tape, and I do mouth breathe throughout the night, then I'm kind of groggy and I just don't feel well rested. So what's the importance of breathing through the nose as opposed to the mouth?
Physiologically, there seems to be, I think, at least 17 or 18 differences. I think we counted once on one of the Buteyko practitioner forums, and I have it also on the page, a list of probably 10 plus advantages, but the main ones would be following. One of them would be, of course, something that we discussed related to carbon dioxide. So when we breathe through the nose, we have large dead volume, which is about 120, 150 milliliters. It's called dead volume. So the volume of air in our sinuses and inside throat and airways, which does not participate in gas exchange. Okay, so when we add this extra volume, we increase level of carbon dioxide in our lungs, and if we have normal ventilation perfusion mismatch in our arterial blood as well, so we have more CO2 in the body cells, better oxygenation as well. So that's CO2. Next one would be nitric oxide, which we produce in sinuses, and that gas helps to also, probably would be number two, was a dilator after CO2. It's also disinfect lungs, so it helps to kill germs when we inhale them through the nose. So through the mouth, we don't have this option, so the germs go kind of unaffected inside our airways, inside lungs, and then can get in the blood, and then can create infection, of course. Now, next factor would be humidification of the air. So the moist narrow, of course, covered with mucus, so air comes moist, not dry. So that again prevents tearing of airways, especially when we breathe quite heavily, let's say during physical exercise. So humidification of the air, warming up of air would be as well another related factor. So altogether, we can find kind of many differences between nose and mouth breathing, and that would kind of allow people to realize that it is important. But practically, you're absolutely right. Like I've had countless number of students who first kind of, oh, what is strange thing? Like I was like actually just yesterday was explaining, like meeting somebody here as well about mouth tape, and kind of it looks like word technique, strange technique, like kind of restrict, suffocate yourself in a way with this tape. But once people start doing that, like try just 2-3 nights, and just like we wake up in the morning and whole day feel different, makes of course them to love this technique. And I know that some people, some practitioners I trained got up to 40, 50, sometimes even 60-second CP, and they still like it. You know, we put tape on the mouth, even though like with these CP numbers and with this like easy and light breathing that we have already day and night, there is no way we open mouth during sleep. So, but we still do it. So that's okay with me, of course. So, but yeah, people like it, and that's why, yeah, that's one of the techniques which developed. I think it was probably even developed by patients, as Dr. Buteyko himself described long ago in '60s. His patients actually suggested that. Decided to tape mouth and started to use this method long ago, just by realizing its importance, significance, and usefulness. Yeah,
It's really cheap. It's
yeah,
probably
yeah. Just
one of the easiest hacks that anyone can do.
pharmacy, micropore 3M, like typical hypoallergic, like all these pores. There are also a variety of now many. You can buy on Amazon like special tapes for just for taping mouth.
Mm-hmm. I think I read in Normal Breathing that it's important to sleep on hard surfaces as well.
Sleeping on the hard surface, it's another part of the classical traditional Buteyko method. That means Dr. Buteyko would teach all his doctors, practitioners whom he trained to use this method. Even though on the West seems to be not all practitioners teach it and explain it, I believe that it's very useful technique, and especially for people who are a bit maybe overweight or have normal weight, would be having even additional benefits. There could be few situations, people who are very slim or skinny, for whom it may be a bit discomfortable because we have too many bones, you know. So and people who have severe sleeping problems would be another group for whom I may kind of be reservant or maybe like would not even explain this technique to certain very few students who have, let's say, severe sleeping problems. But otherwise, it works really well. It allows people to have also, of course, higher morning CP result. So with controlled pulse results, and of course, lighter and easier breathing throughout sleep. How it works, it seems that what happens during sleep when we have very soft surface, and modern beds, of course, something which first of all we never had before. We started somewhere in about 30s and 40s, 1930s, 1940s, where humans also invented a variety of kind of abnormal pieces of furniture, such as armchairs, sofa, couches. So because 1920s and before, they did not exist, they were not popular. People would like standing, and people would do even like with office jobs, even white collar and blue collar, like in shops and so on, would do standing. In banks, offices, people also would be walking standing all day long. Now, so with invention of these soft types of furniture, and bed and mattress also appeared, because we also did not have those medieval times, like we even did not sleep horizontally, seems to be. Now, so with invention of soft surfaces, and when people sleep on them in the horizontal position, there is a very strong tendency to sleep in the same position without changing it for long periods of time, 1.5, 2 or more hours. Okay, and then when this happens, it seems that body's circulation somehow is compromised. You can imagine, like if you lie on one part, like certain organs, tissues, they would get probably a little better blood supply, but some others, due to compression, due to the kind of physical position, would get reduced blood supply. And that, of course, not healthy for like whatever, maybe have inflammation in some part, or some infection or whatever, like some wounds needs to be healed or repaired and so on. So therefore, like here, what happens with, because of that, it seems that breathing becomes heavier and heavier when people sleep in the same position for long period of time. Once you change position, your breathing immediately becomes lighter, less heavier. So you become kind of, in a way, a bit healthier when you change position. But at the same time, like what psychologically is known, because I taught this technique to many students, and I tried myself many times to kind of to see, okay, what are the differences between different sleep positions. The difference would be, of course, following that when you have hard surface, and by hard surface, I mean, let's say if you have a wooden floor and you put a thin blanket, or let's say one towel or just two towels, like two ordinary towels on the floor. So you can imagine it would be really hard surface. Then sleeping on this surface would result in the more frequent waking up. So you would wake up, oh gosh, like it hurts, let me change position. You change position, you fall asleep again. And you wake up again. So throughout the night, you will wake up many more times when you have a hard bed. And maybe psychologically, it's possible that a person would say, oh, that was quite a bad night, like I was waking up so many times. But CP would be higher. And if you pay attention to the quality of your day, you would be also having a better day, you would be functioning better in terms of your like mental clarity and other factors, maybe even like physical exercise. I haven't seen studies, but actually very few people even studied effects of having hard beds. Left, right sleep positions, there are quite a lot of research exists in the Western world about this factor, but hard beds, very few people studied this effect. So that's why kind of Dr. Buteyko liked the idea, and that's why it became part of the traditional classical Buteyko method, sleeping on hard surface. Maybe, well, there are many, sleep kind of by itself very complex topic. So some people may also would benefit from having inclined bed if they wake up at night, or we have like problems with insomnia. Or it depends. When people are sick and they have CPs less than 20 seconds, that could be quite common. When we are talking about more advanced students who have already, let's say, 30 seconds in the morning, would be a very different picture and very different things they complain about.
So it seems like if people are waking up on these hard surfaces and the higher your CP is and the less sleep you need. So sleep is not the rejuvenation tool that we've been led to believe, or people.
Yeah, yeah, that's interesting topic. Yeah, but you are right. Also mentioning the sleep tends to be shorter as well, and that also has maybe a partially psychological explanation. Why? Because according to Dr. Buteyko, we need to go to sleep when you really sleep. So when you start yawning, you like start to maybe almost tears running, like you want to kind of like touch your eyes and so on. The eyes become a little bit itchy, and your body becomes weak, and oh, now I'm ready really to fall asleep very fast. So that's a good time to go to sleep. Why? Because you see, like when you have very soft surface, there's a big tendency to go to bed earlier. And a lot of people these days, it's kind of part of the culture as well. We turn on TV, it takes like popcorn, Coca-Cola, and so we watch TV and like on the soft surface, very unhealthy practice. Of course, lying in the horizontal position and eating and so on. Now, when you have very hard surface, you probably would not have like this inclination or desire to go to sleep early because it's so uncomfortable to go to sleep. And the same in the morning as well, because in the morning, like according to Dr. Buteyko, okay, you wake up, get out from the bed as soon as possible. So get busy with life. If you're really sleepy, get a nap throughout the day, but just don't go into horizontal posture for this nap. Sleep in the. That's where sofa, couches, armchairs are good for a nap during the day. Whatever, 5-10 minutes usually very kind of refreshing, especially for high CP students. Now, talking about duration of sleep, how it became short and why. Well, I forgot also we maybe come back to Wim Hof. We skip this part. So why sleep is not about recovery? It is about, in a way, it is about recovery because we know we consolidate our memory. So like certain things are erased, we get certain things which we think are more important, more kind of in the long-term memory. There is like recovery of muscles which take place during deepest stages of sleep. So when we go into delta, so theta, and therefore, like we see here, kind of there is a truth in that, and there would be also a lot of studies showing that when people have like 7.5 hours, we have good recovery, good sleep, and then we have large group of people sleeping 5-6 hours of sleep, and we have so many complaints about headaches and having like dizziness. That would be true. Why? Because there would be a huge number among these short sleepers or people who have, let's say, sleep apnea. And these people don't get deep sleep at all. Like many of them don't get deep stages at all. And we just don't have, so it's kind of not correct to compare that because it's like very different kind of state of sleep that we experience. And to compare that with other people who have like 7.5. 7.5 is average these days for the Western men to sleep. So what Dr. Buteyko was talking about and what he discovered, first of all, like during his lecture 1968, which I translated in English, it's called Buteyko lecture in the Moscow State University in 1968. He just said plainly that sleep is a poison. So sleep is a poison. That was his experience as a doctor, and we know statistically, kind of, and from epidemiological viewpoint, like from a viewpoint of clinician, that highest mortality and highest chances of attacks or acute exacerbations, all these heart attacks, strokes, seizures due to epilepsy, and so on and so forth, take place during sleep. So people are most likely to die from 4 to 7 o'clock in the morning, regardless of the name of disease that we have. So this is like physiological law, that physiological fact. And that makes, again, like, okay, if people recover during sleep, why we die from 4 to 7 a.m.? So it does not make any sense. So we recover, well, we of course hyperventilate even heavier from 4 to 7 a.m. And that makes them to die and to have these acute attacks during sleep. So now why people recover faster and more effectively when we have more CO2? Well, here we need to think about, again, properties or abilities of carbon dioxide in relation to our brain and muscles, because this is what seems to be main physiological needs of sleep are to kind of to make our brain recover and then to recover, also to restore our muscles. So in relation to the brain, again, these activities of the brain, CO2 is very powerful sedative or calmative or kind of agent for the human brain, so that make people very calm and nervous system function way more stable when people have more CO2. So that's why all type of abnormalities in relation to the nervous system become more and more common when people have heavy and heavier breathing, and the CP gets lower and lower and lower. So nervous system function in a very different way. So people are able to again have fewer cycles of sleep. Because what happens when we have high and high CP, the whole cycle comes out. For many students, I know, like let's say, when I started myself, my CP was 10 seconds. My sleep was about 11 hours. I get CP 20 seconds. My sleep was about 8 hours. 30 seconds, sleep was about 6.5 hours. With 40, 50 seconds, sleep would go down to 4.5 hours. So it was a very clear relationship, which I found in most students would be also true, whom I trained. Would be a few number of people, let's say, like with sleep apnea, it's opposite situation. Sometimes we start and we sleep 5-6 hours, but this is very bad sleep. It's horrible sleep they have. That's why CPAP machine help them to have better sleep quality. Now, when they improve the respiration, they slow down their breath, the sleep gets longer, but it's of good quality now. Later, it starts to decrease if they manage to progress to really high numbers. So muscles, brain we discussed now. Okay, what about muscles? Well, CO2 is a very powerful muscle relaxant. This is also another known fact. So that's why thousands of people, you can find I have video about like how to relieve constipation in 1 minute, with breath holding exercise. I think it has like 500,000 views. It was mostly from the past when it was easier to put this video and to get a lot of views, because these days, like maybe some other videos, we kind of promote it and so on. Easier, but you can read like there would be hundreds of people's opinions, like what we write in the below the video, in the comments. Tell, oh, that actually works for me. Like I tried it in 30 seconds, no constipation. Because smooth muscles of the colon, particularly smooth muscles, react extremely fast. And smooth muscles we have again in the colon, around our blood vessels, around airways. We have special types. They are called smooth muscles, because skeletal muscles were different, and heart muscle would be another type of muscles. But we all would be still dependent, and we would all be responsive to high CO2 levels in terms of their relaxation. So that's why kind of sleep, high CO2 allows people to sleep shorter time and recover their muscles faster and easier. Now, Wim Hof, we forgot about this one. You asked me about, like, well, Wim Hof asked about 30-50 times of hyperventilation. Wim Hof method is much more known, and he probably himself would agree with this idea that it's more kind of about using cold rather than doing something with breath. Particularly, he would not say at all that his technique is about breathing retraining. Okay, so he uses breathing for some other purposes, which maybe some other people may do also for something else. Let's say Stanislav Grof may use it for rebirthing technique. So people may have some kind of, according to his understanding, ideas, thoughts which may be suppressed, and if you hyperventilate, they can come up on the surface. People can kind of make them themselves realize and to speak them out. For example, these things which may be kind of hidden from them even. So, and for Wim Hof, this technique is used to get into cold water as well. So that was kind of central part why he would suggest 30-50 breaths as a method how to get used to extremely cold conditions, such as again going into ice cold water, or when you go into sea, like all these experiences when it's all very, very cold shower, of course, as well would be another example. So when you want to take ice cold shower, I found myself, and I asked many students, we would say, oh, that's true. The use of this Wim Hof additional technique, like 30-50 deep, fast breaths, and you can do it through the mouth, like basically hyperventilation. You can go and use cold water, way more comfortable. You would find it just psychologically much easier to use, because the Buteyko method is also kind of a bit harsh in this way, a bit kind of ascetic and difficult in terms of the traditional classical Buteyko use of cold water would be to use cold water very gradually. So you would say you have very cold one arm, another arm, one leg, another leg. Or if you have warm water running, you just turn the knob, a little bit colder, wait 5 seconds, little bit. So like kind of gradual transition. This prevents hyperventilation, according to Dr. Buteyko, and this is absolutely right. But Wim Hof is actually a very tricky technique, because when you use with 30-50 breaths, it can be used as a part of so-called DIY hypoxic training. And that involves another technique which I teach to students and of course to practitioners as well, how you can use this special exercise. And we do it as a series of exercises which can last 20 or maybe a bit more minutes. As one exercise which involves fast, heavy breathing, then it would involve breath holding, and then it would also involve reduced breathing for about 2, 3, 4 minutes. And therefore, you see that you use this hyperventilation as a only initial part, which would allow you to experience very low level of blood oxygenation, which you cannot achieve otherwise without special equipment. And by special equipment, I mean you can get special air, special machines. And I studied this technique myself, used it myself for many months, like this so-called, it's a whole area of research with like hundreds of doctors working in this area, inventing new devices, new machines, treatment of certain conditions with extreme success for some groups of patients. And it's called intermittent hypoxic hyperoxic training, IHHT. And this is a very new area. We have, again, doctors worldwide. I met like with, how many? Three different practitioners, including one leading practitioner probably in the world who use this technique. So Wim Hof allows us to achieve very high, low level for blood oxygenation, which you can easily measure with, oh gosh, with this simple, I have it accidentally right here, this device, which is called pulse oximeter. You can put your finger, you can start measuring, and it's going to show your blood oxygenation. Now, well, you see, like your blood oxygenation would be whatever, like numbers 97, 98, 99, probably for most people. And if you try to get it to lower numbers, even like, let's say, as low as 92 or 90 or below 90, that would be extremely difficult. You probably, like, if you try reduce breathing or breathing much less air, you would not be able to do that. But if you use this Wim Hof method, our students are able to get below 80. Some people, some students, advanced students I trained could go even to 70 or below 70 with reduced breathing and using Wim Hof method at the same time. So that's what makes it's another big area of research, how this temporary experience of very low hypoxia, how it helps to repair mitochondria, some like cells, and it's again like big part of research, but it can be very beneficial in terms of people having effects even in relation to the breathing retraining. So therefore, kind of Wim Hof, it's one of the techniques which could be used as well for breathing retraining, as well as for, again, like could be used as even as part of the Buteyko method. It's not, again, a technique which has its goal to retrain our breath. Okay, so that's why.
So what would how would you define hypoxia for those that don't know?
Hypoxia is like, it could be the direct translation. It would be just low oxygen level, and people may think about, like, even like professionals or doctors could think about hypoxia in different terms. Two probably most common terms would be, okay, we can have hypoxia when we have too level of oxygen in the outer air, and that happens at high altitude, for example, or when you breathe special mixtures from devices. So that's how you can experience hypoxia in terms of again hypoxic air. So let's say if you go to feet or two kilometers high altitude. So you would have probably about twice less air than at sea level. So that's one level of hypoxia. For our purposes and something which we may discuss earlier today, hypoxia would relate to the state of our cells or tissues. And that is reflected in a totally different test and result that would be low result for the CP test. So somebody who has less than 10 seconds CP, probably from clinical or medical viewpoint, could be diagnosed as someone who has hypoxia. Serious level of hypoxia, low level of oxygen in cells of the brain, heart, and other organs, and that can be, of course, extremely dangerous for both organs, especially heart and brain. And other organs, of course, would suffer. Immune system would suffer, would be many, many abnormalities which would be linked to hypoxia. So that's, and would be a bunch of kind of effects resulting from hypoxia. Let's say one of the very strong common effect due to hypoxia is production of large amounts of lactic acid, which also associated with pain, because so when we don't have oxygen, the body starts to produce energy using not aerobic, because when you have oxygen, you have aerobic metabolism, but anaerobic. And therefore, that would lead to production of lactic acid. Such people would have elevated blood lactate 24 hours per 7, and they would commonly complain about a lot of chronic fatigue. This is what we have. So it would be too much lactic acid due to simple hyperventilation.
So I don't know if this is kind of off the wall or if this is getting out of your territory, but go figure, I actually started reading the book at the peak of COVID. So what implications does the hyperventilation that most people are currently experiencing, whether they know it or not, what relationship does the chronic overbreathing have to COVID, if you know? And
yes,
what
yeah.
Would the retraining the breathing help as a better alternative to what they were doing in the hospitals with the ventilation machines?
Yes, no, absolutely. That would have a huge impact on even on the spread of the disease. I'm certain that pandemic would not exist if we had people with more than 20 seconds CP as a norm. Let's say 90% or more of all people around the world would have 20 plus seconds for the morning CP. COVID pandemic would not exist. It would be weaker than any flu, so would be nothing at all. Now, I have a couple of videos about COVID. One of them was done at the very, very early stage of COVID, when COVID just started. Was it 2020 probably, yeah? And I think video was done in May, when we just got first statistic. I was curious about what we are doing with sick people who have COVID. Why? Because, well, first of all, when people die from COVID, they die from lung failure. And we have a lot of pollution related to the lungs. So we have symptoms of shortness of breath, a lot of cough. And so we have respiratory infection in the lungs. And that completely relates to asthma, COPD, and other symptoms related to these conditions. And we know that they can develop only if a person has less than 20 seconds for the CP test. So, because with 20 plus seconds, the immune system is strong enough to deal with these pathogens naturally, so you don't even notice them, the same way as it happens with probably thousands of different germs which enter human body every day. So COVID should be technically the same. Now, what happened at this time in May 2020, when I made first video, I was curious, okay, I knew that some doctors actually are already smart enough to prevent sick people from sleeping on the back in hospitals when we are in critical care and emergency, and we have kind of fighting with death already. And at this moment of time, there were already several studies published about doctors starting to understand and realize the huge importance of sleep position in terms of reduction in mortality, probably by about factor of 7-10 times. just by this factor alone, sleeping position at night. So it's how we lie down the patient. Now, what I found at this moment of time, I was looking at statistics in different countries in relation to COVID mortality. And by this time already, we already had like tens of thousands of patients around the world. And one country I found that had extremely low mortality in comparison with other countries. Why? Because when COVID came to, let's say, Europe and later United States, Mexico, for many, many months, the mortality was at the level 10, 15 or more percent. Very, very high. You can imagine 10, 15%. This is what happens in Spain, in the UK as well, like in April, May, June of 2020, when COVID just arrived to Europe and United States a bit later. So mortality was extremely high. I was looking for mortality again, like among different countries, and I found one country where my mortality was 0.05%. 200 times less. 200 times less. So, and I was looking, okay, what was going on? What was wrong? We had already by this time 50,000 patients with COVID, but mortality was like, I think just 7 people died. No, out. So it was less than ordinary flu, the mortality that we got from COVID. And I was curious, okay, what did we do exactly? That was Singapore in 2020 in May. And well, you know, like doctors, they're supposed to do this job themselves. Okay, if there is a country with such a positive effect of the measures in relation to COVID, why we don't want to scale it to other countries and get the same result? So I found an article printed, published in South China Morning Post. It's a very large newspaper, even though it's a little bit long name, South China Morning Post called. We have online articles. I think it's probably like very old newspaper as well, but it's very popular newspaper on the east, of course, like China, all these Asian countries, where we described when one doctor provided their experience, and he described actually 3 factors that we did in Singapore differently. And the first factor that he mentioned that he told that we did not allow supine sleep for the patients. So we could not sleep on their back. So we were preventing sleeping on the back. And that was again, like according to my estimates, would give about 7-10 times reduction in mortality anywhere else in the world. Later, we did not tell that much in the public, because later all these countries I mentioned, like United States, Canada, Spain, the UK, we started to do the same. That's why the mortality dropped so dramatically, because we had up to 10, 12, 15% mortality at the beginning of COVID. We started to prevent the supine sleep. The mortality dropped by about, again, like 7-10 times, probably close to 1% to level which we had for many, many months later. Now, another 2 factors which was mentioned in South China Morning Post were they were asking the patients to do some minimum amount of physical exercise, okay? And without providing further details, but of course we would not be able to invent anything like particularly new. Most likely we would ask the patient just to breathe through the nose during physical exercise. And last factor that we mentioned, we also mentioned that we actually made some changes in diet, also without providing any specifics. But here again, like if you work in areas related to diet, where doctors study diet, and these days like thousands of doctors, like it's already became during the last 10 years kind of norm, even like leading medical schools around the world, we already started to include courses in diet for future doctors. So, and of course in these courses we teach things which work. And during the last 10 years, probably the biggest change that took place, 10, 15 probably years, starting from the United States, later Europe, would be a big increase in medical practitioners, doctors, dietologists, nutritionists, using low-carb, ketogenic type of diets, and even more kind of stricter type of diets, going to like carnivore diets, zero-carb diets, and so on. So, because like there is kind of not so much we could invent, I mean, in Singapore. So most likely we just moved in this direction. Why? That would be also having huge impact, because inflammation is a very, very significant factor during last stages of COVID. And this diet particularly well designed to address, to prevent inflammation, to reduce inflammation in the whole body, because ordinary diets just would not have this effect.
I believe I just read it earlier today that so are you a proponent of those diets, the ketogenic and the carnivore? Would you say those are beneficial for most people, or?
Well, most, it's hard to say that would be most. It's a diet by itself, like again, huge topic, but it's certainly talking about severely sick people. I believe there is would be a very, very large number of severely or critically ill or dying people for whom applying this diet is probably could be the only way to go, or the sure way to go, or probably like the most studied, or the way that I would certainly advise them to use as soon as possible. So would be this kind of answer I can give. In terms of people who are relatively healthy, who have good digestion, I have a couple of books on digestion on Amazon as well, describing kind of what I discovered and in relation to breathing retraining and diet. I believe the biggest kind of single factor, which I always teach to students and practitioners as well, would be about having a state of the digestive system when you eat food that does not cause you harm. So when you do not get adverse reactions from food that you eat. And we measure it by having, again, like cleaner gut, or like talking about, okay, well, how we can we have like simple kind of measurements, because doctors these days, we would do different tests, and we know that in sick people, there is large tendency to have biofilms, or biofilm, film in the digestive tract, the layer of pathological bacteria inside the gut, and having also increased intestinal permeability, which is more commonly known as a leaky gut syndrome. So doctors do special tests again for those, but it seems that from experience of our students that there is very simple test which people can do themselves and which can reflect the state of gut really well. And that would be the test which kind of, I call it not the test even, I call it the so-called no soiling effect, or soiling effect. Well, we have like both of them. So soiling means the state when you require toilet paper. So when you soil yourself after your bowel movements, and the amount of toilet paper and like what happens there, and also like if your stool going to leave marks, if it has offensive smell, there are many kind of factors which also would reflect the state of flora in your gut, what is going on in your digestive system. It's kind of hidden from us, but we have the outcomes, so therefore we can analyze those factors. So what I noticed a long time ago, asking like advanced students who got 50, 60 second CP, that it was extremely common for them to have no soiling at all. And and that would happen because of breathing retraining, whereas later we started also to apply, probably up to about already 5, 6, 7 years ago, and in recent years, of course, as well, would be even more larger number of students who would start to use low carb diets, like taking out all starches, grains, and so on. And they would sometimes say, like I had many students like this, they say, oh, in 2-3 days, we say, oh, I have no soiling now at all. Even though we would require toilet paper all their life. So for them would be, of course, like kind of a very, and for most people, that would be an abnormal experience, because carbs would be number one type of food, I believe, that causes soiling. Food chewing would be a huge factor here as well, because we had also many students who just start super good chewing and eating maybe carbs in more kind of dried form, like eating, let's say, rice cake, not rice, but rice cakes, not just bread, but dried bread, and chewing it very well. So it's possible also to achieve kind of way better gut flora. But cutting carbohydrates, just another kind of simple option people can do, and that would also be a huge factor in achieving no soiling. As well as I just heard many, like even just like from recent students and practitioners, just like weeks ago, a month ago, hearing from them that, oh, now I know, like with changes in diet, once I eat pizza, I get just more soiling next day. So that's how I see that it's actually is a factor, is a big factor. Or pasta or whatever, like something which can cause this type of effect. So therefore, my kind of central idea here would be to my students, I tell, oh, just you achieve no soiling, and like if this diet produces no soiling, you have clean bowel movements. Yeah, you're mainly good with your diet. It might be some, of course, fewer, because it would be still a lot of maybe some nutrients, some other effects related to diet here. But at least number one problem, which again exists like probably 99% of general population, this problem would be solved.
You may have just saved a lot of people some money on toilet paper.
yeah, that would be also kind of.
The last question that I really want to ask on the diet, just because I had it pulled up, was it says methods of food preparation, processing, and their effects on breathing. So raw has a small effect compared to fried, grilled, and deeply fried. Those would have a very large effect. So
yes, and Kent would be probably among the worst, according to Dr. Buteyko and Russians, because they would actually list even those type of foods in their manuals, because I read many resources, manuals in Russian about that. Yeah, they would start with raw as the best type of food to eat. Yeah, and yeah, raw, frozen probably would be next one. Dried would be another one. Enzymes would be already lost. Then would be what, probably light cooking already, some preparation techniques. And then those that you mentioned, deeply fried or grilled, would be among the worst, because especially when you start to make food like a little bit yellow or brown, especially, it would be already those things which are used by some doctors to produce cancer, for example, in mice, artificially. Like when doctors want to investigate cancer, we start to feed mice, you know, with these chunks of burnt food, and they develop cancer, and we call them. So yeah, those, and probably Kent would be among the foods which would be in metal cans, of course, not glass jars, would be a safe option, or safe alternative to use. Yeah, so, this makes sense. Yeah, that's ideas. Yeah, Dr. Buteyko explained.
So you would eat like raw meats too?
Well, I myself may eat sometimes too. Yeah, raw liver. I myself, I probably would likely to soak it in vinegar, depending on type of, because you know some livers could be. It's also very variable. Like if I recently, let's say, I bought some organic chicken liver or organic turkey liver. It's a big problem, because you know when you buy liver from so many animals, chances of getting like salmonella, botulism, like all these fancy things, like way higher. So it would be probably better, like I would just likely fry them very, very lightly, just, or boil very fast, like just 1 minute and so on. But when you're talking about like you get like liver from some calf, you know, calf liver can be very large, or like lamb liver, so pork liver, pork probably better if you buy organic. But those would be from one animal. You can slice it. Those it depends. If it's beef liver, a bit tough, this one probably would be better to soak in vinegar. But those softer ones, you can eat it straight, or you may soak it. Soak it also can, in vinegar also can help to kill some germs. So meat, yeah, it depends. Meat grinder is a great thing to use, you know, grinded meat, and you can eat it right away as well. So that depends, yeah, on this person's situation. But that would be certainly having surprisingly, like when I discovered, it was a long time ago, I don't know. It was a yearly like start of my kind of breathing retraining career, like yearly like at the beginning of this century. Yeah, I was surprised, like eating like this raw meat, raw fish, just goes like a fruit, you know, like almost no changes in breathing, like does not make your breath as heavy when you eat the same food cooked, particularly meats, for example, or fish. So would be, of course, big difference in terms of faster digestion and breathing, easier breathing retraining. Plus, of course, using of spices was something which Dr. Buteyko was also ahead of time for decades. Because spices, it's a very, very new area as well, because I think even 1990s were very few, if any, research papers done on positive effects of spices, whereas like starting, I think probably 2000, this first decade of this century, where there were like thousands, like explosion of research on positive effects of various spices, so-called synergetic effect of spices, which also Dr. Buteyko emphasized when we have variety of many, let's say 5, 7, 10 or more different types of spices in one meal. So very positive effect on production of digestive enzymes, faster digestion, suppression of pathogens. So kind of many benefits from using this type of foods, provided that again you don't have any adverse reactions. You should not use something which again cause you indigestion or some symptoms.
How do you manage this while you're on the road? Because you travel a lot. So
yeah, that's the thing. Yeah, of course, you have to go to big supermarkets, see like some health food shops, yeah, organic food shops, and see, yeah, it's a complex thing. At home, yeah, when you know everything kind of at home would be a bit easier. But I usually know, yeah, places. So I know big cities. So,
the cold exposure, you kind of touched on that before, and I do like ice baths, so I've done the Wim Hof trainings before. And the previous guest, we were actually talking about how people nowadays are very comfortable. So we have the sofas and we have AC, so we can always keep a comfortable temperature for us, but we're not really ever exposed to the cold. And you mentioned how the Buteyko, Dr. Buteyko, he mentioned that you just pour like a little bit of cold, I guess, on your arms, like one limb at a time instead of just dousing yourself in, because initially, if you're not accustomed to it, you're going to get like a
yep.
hyperventilatory response when you
Mm-hmm.
just jump into a full cold shower. So what's the importance of the cold here? And I actually believe that you mentioned in your book that we dress a little bit warmer than we should. So um, being literally overheated may be contributing to overbreathing as well.
Absolutely, yeah. Overheating would be also a huge factor. Here, it's a big kind of a tricky topic as well, because reactions would be also quite individual. So in terms of for some people, overheating can have a huge negative effect, a very large negative effect in terms of the poor health. Now, talking about what are the physiological benefits, also like could be a list. Like I have a page of benefits of cold shower on Normal Breathing website. People can study if they want this part. Endorphins probably would be one of those which many people mention, but it seems to be that there is another factor which could be even more influential, and that relates to also hypoxic training. Because when you, brown fat cell production, brown fat production would be another huge one for cold exposure as well. So which I also discuss, I don't remember where, on the websites or maybe in books, like videos somewhere. What would be here related to hypoxia is that we accumulate a very large amount of damaged mitochondria in cells, in muscle cells, and other organs where mitochondria and we exist virtually everywhere. Like this is machines to produce energy, so to generate energy from oxygen, and they often get damaged. And when they become damaged, they cannot function normally or properly. So they kind of still present in the cell, but they don't do any useful work. And this so-called hypoxic training techniques, DIY hypoxic training techniques, so even better to use this intermittent hypoxic, hyperoxic training, or DIY Wim Hof, DIY hypoxic training, which I already mentioned a little bit here. But cold shower, this is where I also like discussing with professionals in this research, where we also say, oh, actually, there are a couple of more techniques which give additional advantage in relation to use of hypoxia. Like I'm talking about doctors who use, professionals who use this hypoxic and design and create and they produce these hypoxic machines. They're saying that actually there are two additional factors which makes very hypoxic machines and very hypoxic training for other people way more effective. One would be physical exercise and another one would be cold exposure. And cold exposure, somehow it's able to, again, to help the immune system to find and repair these damaged cells, the damaged mitochondria, so that they start to function normally. So that would be kind of additional factor, but altogether, like physiological differences, it's huge. There is like, well, with Wim Hof, there would be also growth hormone, adrenaline, noradrenaline changes. Like it's a kind of so many things involved at the same time, even difficult to tell what exactly, like the exact mechanism, but we all seems to be providing a positive contribution. And also we are also something which kind of physiologically were common, normal for humans to have in the past.
It just seems like we're very understimulated, especially with the brown fat, because that was a topic that the previous guest also mentioned a lot too, in relation to the mitochondria, how it's just kind of dormant.
Mm-hmm. Yeah.
So if obviously you can get with a Buteyko practitioner if you were interested, the guests that are listening, in learning how to retrain your breathing. But Dr. Artour, what would be some quick practical tips if you had like 5 that people could use just on a day-to-day basis that could make a dramatic impact on their health?
But I think we discussed already today, at least probably 5, those things which a lot of people find very influential and useful, such as we discussed with you, nose breathing during physical exercise. You remember, yeah? Mouth taping at night. So this is we also discussed. Then we discussed prevention of supine sleep. So that would be the 1, 2, 3, 4, 5. Hard baths, you mentioned as well, could be one of them as well. This is again something which does not involve kind of extra time, like kind of simple trick technique. What would be else? Hard to tell. It could be again, like for some people, I had many students for whom yachting grounding would be very influential additional factor, even though it would be also students who did not find positive effects in this method at all. So it would be a kind of variety of responses. So it's kind of individual things. They are one of the individual things.
Have you ever slept grounded?
Oh yeah, many times I tried that. Yeah. In my personal case, it has actually very little effect. Maybe once, like first time, I get little tingling and that's it. But even sleep quality seems to be not much improved. But I also tried it kind of on and off. You know, I sleep grounded like 2-3 nights and stop for a week or longer time. Then I try it again. In my case, not. But I know a lot of students who try it. And later, like we travel or whatever, like sleep with relatives, you know, visiting somewhere. And we feel, and we come back and we like retest, and we realize that actually as soon as we are not grounded just for 1 night, we sleep way worse. And then we try to sleep grounded every single night, always. So that just, some people are having this type of response.
Yeah. My partner actually removed, because I have a grounding sheet for my bed. She actually removed it on accident without telling me the other day. And that was the only day in probably about 2 years that I've woken up with a headache. And then she told me afterwards, and I was like, oh, makes a little bit of sense. So I would say that I'm a little bit more sensitive. But I guess it seems like there's this this level, I guess, that you can reach where you don't become as sensitive to any type of perturbations, whether that be, okay, you're ungrounded for
I believe so. That's why, you know, there is one strange phrase, very weird phrase from yoga, which you can find actually in ancient Sanskrit texts, where they say that when you become like a yoga master, like with very short sleep and of course very high CP, breath holding time, you just, you can start flying. This is how they translate it. But my understanding actually was that actually you don't need to get grounded, meaning that you can be on some surface where you're not physically, like electrically connected with the earth. In the past, it was really hard to get disconnected with earth because we just did not have all these artificial things you know. So therefore, it was a very kind of uncommon situation for them. But it's possible that when the translation from ancient Sanskrit to like modern English, they did not mean that you were able to fly, but you actually probably they meant that you are not there is no necessity for you to be electrically connected with Earth at all when you have very, very high CP. Probably this is right. Probably. So that's my interpretation of this kind of, okay, what it is about, like you can fly. So.
May I ask what your CP currently is?
Oh, it's now it's long story because I had a big for many years I did not know what was going on with my health, even though I had some breakthroughs to having CPs like 50, 60 seconds. And only 4 years ago, I discovered that I had very, very high level of mercury in my body. So I did a hair analysis about 4 years ago in one German laboratory for heavy metals. And they discovered that my mercury level was 10 times above the upper limit. So very, very high. And I believe it was related to poisoning that took place in late 90s, very, very long time ago. I was just not aware about this heavy load because very few people, like or doctors even, would suggest you because these tests are very expensive. And doctors like would never even suspect that you may have this type of problems. So therefore, kind of, yeah, it caused me big health problems developing like with liver, kidneys long time ago. And then it resulted also like, you know, when kidneys and liver are not able to detoxify from mercury, it starts to pile up in your digestive tract because there appear patches in some like areas in the digestive tract which are still able to pick up some mercury and take it out from the body when your kidneys and liver are not working well. So these are conspiracy people probably produce noises here who may know more than I do about this mercury poisoning. So
Well, I really appreciate your time, Dr. Artour, and this is the type of stuff that I think needs to be taught very, very early. I think our education system's kind of backed up. People are not learning any principles, are not learning how to eat properly, not learning how to cook, not learning how to
sleep, exercise.
Sleep.
Exercise, yeah. Breathe.
It's all bad.
Yeah.
And I see like 30, 40-year-olds that have graduated higher education and then they don't know what to do with their bodies. So can you ever foresee things like breathing retraining being, or it wouldn't be retraining if it was just taught early. Could you ever see this being implemented in the public education system?
Yeah, well, difficult to say how many decades or centuries it may take. Yeah.
We'll see. But you're a part of it, so.
Yeah, thank you, James. Yeah, thank you for also promotion and doing this work.
Of course.
I believe, yeah, it's nice, of course, very important things for people to know about.
So you have the Normal Breathing website. You also have the book Normal Breathing, which I'll post all of this up in the show notes. Is there anywhere else where, because the Normal Breathing site's like a blog for you. It seems like you have many, many different articles up there.
Normal Breathing site, it has more than 500 web pages.
There we go.
It's also a good resource for people to learn. There is like in the middle, learn here, where there are many, 25 something like models, separate blocks where people learn various techniques related to breath retraining. But books, yeah, we go a little bit in more depth. And they also have like this YouTube channel with covering like specific topics related to various health problems, sleep, diet, exercise, like many factors related to breath retraining. So would be also like people can find information, yeah, there where I talk sometimes, yeah, just alone, sometimes with somebody else about this type of topics.
Awesome. Well, again, thank you so much for your time, brother. Love your work. Love what you're doing. And just keep it up, man. Thank you so much for your time.
Okay, thank you, James.